It was the last day of play in 16-year-old Brooklyn Zansky's junior varsity softball season. During the first game of a doubleheader, she was pinch running for the pitcher. Brooklyn saw an opening and made a run to steal second base. And that's when everything went wrong.
I was just about to slide, but at last second, I decided not to. So I came back up and I heard a pop in my knee and I just fell to the ground.
To be honest with you, I laughed because the fall was so funny. And then I don't know what told me, but I knew she was injured. When we went to go see her pediatrician, she knew that there was a significant injury. So she got us into children's right away that day.
After an MRI, Brooklyn saw Dr. Kunal Kalra, a pediatric orthopedic surgeon at Children's Hospital of Michigan who specializes in sports medicine. And the results weren't good.
When I saw Brooklyn's MRI results, I saw that she has a complete ACL rupture, as well as she has a tear of her both menisci on the inside as well as outside of her knee. ACL is also known as anterior cruciate ligament. It's one of the ligaments in the knee which is very important for any kind of pivoting movement of the knee. The meniscus is a piece of tissue in the knee which acts as a shock absorber and evenly spreads the forces in the knee. I would say that the tear on the outside of her knee, that is on the lateral meniscus, was quite severe.
Tough news for a high school junior who had found out just 2 days before the injury that she had made the varsity cheerleading team.
I was very crushed and upset when I found out it was an ACL tear because I was very excited for my cheerleading season and I was thinking, oh my gosh, like, am I going to be able to do competitive cheerleading? And I was just very worried and I started to cry once the doctor walked out.
Dr. Kalra told Brooklyn that she would need surgery to repair her ACL and meniscus. Surgery of this nature, when performed on children, requires the expertise of a pediatric orthopedic surgeon so that damage isn't done to the growth plates on a child's bones. These plates allow children to grow as they get older.
ACL is a ligament in the knee which unfortunately does not heal by itself. So we have to replace the ACL with a tissue. What we do is we recreate the ACL in its native position by drilling tunnels in the bones around the knee joint, that's the femur and the tibia. We do insert the ligament into those tunnels and fix it with either a screw or a suspensory ligament device. Ultimately, her ACL will incorporate into her bone and she will have a new ACL which will function almost as well as her original ACL ligament, if not better. So as you know, you had a meniscus tear as well, both on the inside and the outside.
I loved Dr. Kalra. He was very nice. I understood everything he was telling me, and I knew exactly what was going on. He was just a very great doctor.
A great doctor who sees this type of injury often, especially among athletes. It commonly occurs when an athlete jumps, lands, twists, or pivots the knee in the wrong way. Dr. Kalra says ACL injuries are on the rise, especially among girls.
It's more common because kids these days are playing on a more competitive level and they are bigger and faster than the kids 20 years ago. Unfortunately, we are seeing a lot of ACL tears in younger kids as young as 6 to 7 years of age.
Following surgery to repair the ACL, intense physical therapy is needed to strengthen the knee. Patients receive therapy for 6 to 9 months depending on the speed of their recovery. For Brooklyn, she was determined to push herself to be back in action for the beginning of competitive cheer season in December. A lofty goal, considering that was just 5 months after her surgery.
I think that she'll reach that. I mean, she's determined to put in the work and to get it done.
I go to the clinic for physical therapy 2 times a week, and I do 3 days of working out with the school trainer.
8, 9, 10. Good. 5. Hello.
3 months after her surgery, Brooklyn was back in Dr. Kalra's office for a follow-up appointment.
Brooklyn is doing very well. She is recovering very well from her surgery. In fact, I would say that she's among the top 10 percentile of the patients in terms of rehab and recovery of her muscle strength. Typically at 3 months, you do not expect full recovery of the muscle strength. You see that around 5 to 6 months after surgery.
With that great news from Dr. Kalra, Brooklyn is headed towards full participation in her cheer season this December, as well as varsity softball in March. Quite a triumph after such a setback. When she looks back on her experience, she wants people to know that sometimes injuries like these can be prevented.
Every athlete should properly warm up because it could affect how they perform during their game or competition or meet or whatever they do. I think that my mental state of mind is a lot better towards doing my activities. Like, I would sometimes, honestly, I would slack, but now I feel like that I shouldn't do that at all because I don't want to end up with another torn ACL. I just want to be the best athlete that I can be.